When it comes to health and finance, being prepared for unexpected health challenges is crucial. Understanding insurance coverage and the concept of value-based care is key. Value-based care, focusing on patient outcomes, makes healthcare more cost-effective, while comprehensive insurance coverage safeguards against unforeseen medical expenses. Economic stability in health isn't just about personal finance. It's intertwined with broader societal issues like housing and food security. Preparing financially for health-related life changes means being ready for costs associated with health emergencies or chronic conditions. It's not just about insurance. It includes emergency funds and potential career shifts. Investment in public health is vital for economic stability during health crises. Strong public health infrastructure helps cushion the financial impact of health emergencies. In essence, financial preparedness for health changes is about understanding healthcare systems and personal finance management. This knowledge helps in navigating health emergencies, ensuring financial implications are manageable, and focusing on recovery and well-being. Healthcare costs is another area like college tuitions where costs keep rising, not going down. And prior to this live stream, I just had a call with a client and their investment committee. I think 2 individuals are battling cancer right now. And I think we're all touched with, right? You know, somebody, either family member or friend, and somebody has a health crisis that they're dealing with that's totally unexpected. Stephanie, you talked about the emergency fund for relocating when you get a new job. Do you advise clients to build that health emergency fund? And how much should that be?
Yeah, absolutely. Right. I mean, this is where it's important to understand what your health insurance actually says. What are you on the hook for? Some people think, oh, I have insurance, I'm good. But there's co-pays, there's deductibles. A lot of people are now in the high deductible health plans, which is great. And that means your out of pocket is higher. So you have to build that into your cash planning. Even if you're young and healthy, or you think, oh, I'm doing good, you could trip and fall and break your ankle tomorrow, right? There's no predicting these health issues and when they might come up, right? You go to the eye doctor and all of a sudden you need super expensive glasses, you have dental work. It just, there's untold uncertainties there. So that's where I think integrating your cash reserves with what your health insurance covers and for whom, right? How many members of your family and what does that mean? You have to multiply it out to make sure that, hopefully you're in decent shape if these things hit.
Absolutely. You mentioned the high deductible plan. So I want to ask Josh, when it comes to health emergencies, how do long-term care insurance or health savings accounts, which the HSA would be part of a high deductible healthcare plan, how do those come into play?
I want to piggyback on Stephanie's comment about the out-of-pocket numbers. If you have a high deductible plan and you don't know what your out-of-pocket max is for the year, you're doing yourself a disservice because you can hit that number in a hurry. 2 teenage boys and a very athletic 8-year-old last year led us to reach our out-of-pocket maximum very early in the year. And the year before also with broken bones and surgery, and it just comes out of nowhere. So if you're building out your financial plan and you don't know what your out-of-pocket max is, that's a big liability that you're going to have to write a check for, might potentially have to write a check for. So that can help you decide how much money do you save in that HSA and where do you put it. A lot of attention gets put on HSAs because of how great they are from a tax saving standpoint. And, if you accumulate all this money, you'll be a gazillionaire when you're 65 and there nobody really audits it. So there's this, really cool way to have all this tax-free money at 65. But if along the way you're building up $15,000 and $20,000 a year healthcare bills on your credit card because you're not paying attention to your out-of-pocket maximum, that's kind of doing it the wrong way. You got to kind of balance both of those things out. So if you're building out your HSA plan, I would suggest that out-of-pocket maximum is the money that's in the cash portion of it. And that's not very sexy, and that's not going to give you any returns at all. but that's literally your healthcare emergency fund. You've got your regular emergency fund for other stuff, but the HSA, or at least a decent amount of the couple first years of contributions, should be in cash, because that's what it's there for. There's also all of this stress around keeping track of these expenses for years and years and years. The government's not silly. They're going to wise up to all of these hacks that people have for these different things. And, we're saying, hey, we can accumulate this money for 30 years in a tax-free account, and nobody's going to bat an eye at that. It's like, settle down. They'll figure it out. There's going to be a congressional hearing, and all of a sudden we're going to have to produce all of our healthcare receipts from, 1996 to get the tax-free benefit. And, meanwhile, you're, biting off your, what do they say? Biting off your nose to spite your face by accumulating credit card debt because you can't pay the hospital bill out of pocket. So a healthcare cash flow plan, I think, especially if you have a high deductible plan, you need to know how you're going to write that out of pocket number should it happen to you, because it will someday. If it hasn't yet, it will.
Well, it sounded like at least your kids very efficiently all got injured in the same year last year.
Well, to be fair, they did it 2 years in a row. So we are two-time award winners of out-of-pocket maximums. And then, the other side of that happens, we're a small business. We have small business employees, or, we're a small business employer. So that affects our healthcare premiums in the future. And it's a 2-year delay between the price increase and when we actually did stuff. So the stuff we did in 2022 is affecting our premiums in 24 because it takes a while to settle all that out. So, you have a big healthcare year and you think, okay, I'm out of the woods. You're not, because a year and a half from now, you're going to get a premium increase, right? Because, all the dust settling from that cost. So it's the gift that keeps on giving, children. That's the theme here today.
Mary Beth, any advice on how do you deal with or plan for these unpredictable health emergencies without compromising your other financial goals?
You wrap your children in bubble wrap. That's what you do.
No trampoline park.
No trampoline parks. Yeah, we have that rule. That is one of the rules in our house. But really, it's about prioritizing. And so, as OG just mentioned, in terms of keeping that cash in your health savings account, if you're not prepared for that out-of-pocket expense, which we also hit our max last year in our household as well, if you're not prepared for it, it can really throw off your emergency fund, because that's a huge chunk of change that will then come out of your emergency fund. And so then you're replenishing the emergency fund. So if you're able to set it aside, if you're doing the health savings account, great. And if you don't have a health savings account, making sure that you are tacking it on to your emergency fund as well, because you're going to need to replenish it. So taking an eye each year as you're electing your insurance benefits, bumping up your emergency fund just a little bit if needed. The other thing that I really see, so we're talking short-term injuries, right? So there's the out-of-pocket costs, there's hospital costs, there's those bills that are going to hit you. There's also the potential that you're not able to work. And then what happens? And so we're talking about health insurance and the coverage there. Hopefully your emergency fund can supplement. But when you do have some sort of long-term issue and you're out of work, that's where something like disability insurance comes into play, right? So and I think it's an overlooked insurance, but our human capital, our ability to earn an income is one of our greatest assets. And so depending where you are in age, making sure that you understand whether it's employer benefit or if you need to supplement with a private policy, but the disability insurance from a long-term perspective, if you don't have, and you can't plan for that, that's where disability insurance does cover you, because your emergency fund only covers 3 to 6 months of expenses. And so looking at a group policy is definitely going to be the most affordable option if you do have it through your employer. But again, making sure you understand the coverage limits that are there. But I would say going into that's how you also hedge, is by making sure your income, your ability to earn an income is protected.
If I could just jump on that for a sec, I'm seeing one of my good high school friends this coming Monday, and she, when her second son was born, had some strange blood test results. Turns out she has a rare form of leukemia. She has been on disability for 22 years. Her youngest child is 22 years old now. So they've been able to keep their house in nice suburban New Jersey and keep their lifestyle, even though she could no longer, actually earn an income. So, you might think disability is not that common. It's very common. And the people who come to me asking about it are the ones who've seen it really hit friends or family.
I love the discussion of this, because I love the fact that disability coverage. I don't love the first part of this sentence, which is that back when I was an advisor, and I can tell by questions to the show that we get now, disability insurance, it is an extension long-term care, is the type of insurance nobody wants to talk about. People go, oh, it's not going to happen to me, right? Mm-hmm. And yet you look at the price tag on both of these, and you see the huge devastation that it can bring. Leads me to this maxim, I think, that everybody watching this needs to remember, which is if insurance types cost a lot, those aren't necessarily just insurances you want to buy. Whatever is causing that is a risk that you want to make sure you have a strategy around. And so you want to have a strategy around disability. You want to have a strategy around catastrophic illness later in life that would mean a long-term care stay. And it's specifically because these actuaries are paid a ton of money to know where the risk is. And you could tell because those premiums are so flipping high that is where the risk is. Versus, as an example, a lot of people try to shortcut their disability insurance and instead take accidental death and dismemberment, which a lot of people don't know on your flex benefits is something a lot different, and it's cheap for a reason. You're probably not going to use it, especially if you have a desk job. I mean, what's the chance, if dismemberment means losing an eye, losing a finger, what's the chance if you have a desk job on a computer that you're flying along on your keyboard one day and you slice off your index finger between the J and K key? Probably not going to happen.
That is invaluable advice. Don't hit the J or the K.
Don't. So mind your P's and Q's, as they say.
As we're all looking at our keyboards right now.
Where's the J and K?
Next to each other?
Yeah, where's the J and K? I was just looking.
Let's move to segment 4.